My name is Bandana Saini. I'm a professor of pharmacy at the University of Sydney. So, the medical term for hay fever is actually allergic rhinitis. Rhin means nose, and itis means inflammation. And the term hay fever was probably used more as a misnomer in the past to describe that these symptoms happen during hay making, season. Essentially, what allergic rhinitis is really an allergic response to particles in your environment that you inhale through your nose, and hence, it's rhinitis for the nose. And they cause an allergic kind of reaction, which gives you those classic symptoms of itchy nose, wanting to sneeze, and a stuffy nose. In your body you produce substances called immunoglobulins. Now these are very, very specialized and very targeted to whatever caused that whole reaction in the first place. So then you are said to be primed to that allergen or particle that caused the problem in the first place. Throughout your life, then, whenever you're exposed to the same particle or similar particles, your body will have the same reaction. So the reason why spring is associated with allergic rhinitis is that one of amongst many, one of the causes for this reaction to start with in the first place are pollens. Things you could do potentially are to avoid being outdoors in high pollen season. And nowadays we have a lot of apps on our phone that we can download. So the aerator app is one example, but there's many others. So you can actually keep a watch on when the pollen count is high and stay indoors. And if you do have to go outdoors, then it's a good idea to potentially wear a protective mask, which is not an ordinary mask, but P95 mask that actually prevents the particles from getting in through the mask into your nose. So wear a mask. And then other common sense things to do might be, if you've been outdoors, when you come back home, to take a shower so that any pollen sticking around on your hair, your face, or anywhere else on your clothes, you actually remove the clothes, change, and take a shower so you get rid of those pollen. At the moment, what I would say, and I will have to refer to my background as a pharmacist, we do have very effective treatments for hay fever or allergic rhinitis. And depending upon if your hay fever just happens for a few weeks in the year and the symptoms are there but they're not that extremely bothersome, you're at that level, then you could try oral antihistamines. You will see them everywhere in pharmacies, being advertised at the moment as well. So that's an easy solution. But then for people who have a more severe set of symptoms that impact your work, your activities, your sleep, or that you have your symptoms for a longer period of the year, then you have what we call corticosteroids. And steroids they're not the anabolic steroids to build up muscles. They're a different kind of steroid that actually are anti-inflammatory in nature. So they're very powerful in completely suppressing the inflammatory reaction that you have. They normally are used in nasal sprays, which means that, and the newer generation nasal sprays are so well designed that most of the medicine remains in your nose. It targets your nose and cells in your nose rather than being distributed to the rest of your body. So your body isn't that much exposed. So it's a good idea to chat to your GP or pharmacist to work out whether you need to have anti-inflammatory medication or just antihistamines. And then not only that, but also if a pharmacist or a GP recommends a particular nasal spray, you should really get your pharmacist to show you how to use that spray, because it's really important that when you use the spray, you're treating the nose. It's not just going down your, throat and into your stomach, where your some stomach will digest it and you get no treatment. One of the things that can be done is to consider something like immunotherapy, which of course is not the answer for every single person with allergic rhinitis. But in children, it's been shown that if you know what your causative, uh, particle is that's causing these allergies, and if there is a known immune substance that an immunologist has in their armory, then you can do something like immune therapy, where you teach the body by regulated exposure to this allergen or particle, and you teach the immune system to not respond. So you expose the person to small doses of that allergen, you increase the doses till actually to a point where you don't react. The process of inflammation in the body is very complex, and there's many different, uh, to use a simpler word, chemicals and different kinds of cells that might be involved in leading to this overall reaction. And so what immunologists and I guess respiratory researchers are doing is try and pinpoint all of these different cells, enzymes, and chemicals that are leading towards that full blown response. And if we can find cells that are upstream, so they're the first point of starting that reaction, and target them, that's a way of not having symptoms. Of course, you still have the reaction, but you prevented the reaction from actually occurring. And so you have these new targeted medications called biologics, and they're called biologics because they are actually biologic in the sense that they have what's called an antibody, and they direct that antibody against a particular cell. So when you have vaccines, you have antibodies to a particular germ, yeah, and that's how vaccines work. But here you might have antibodies that target a particular cell or a particular enzyme in the body, causing or being part of that inflammatory pathway and cycle.